Fibromyalgia is a long-term condition that affects how the body processes pain. The result of fibromyalgia is experiencing discomfort and tenderness in many of the muscle areas, joints and soft tissues. In fact, algia just means pains, whilst fibro and my refer to the soft tissue and muscle involvement. This was previously referred to as a process of central and peripheral sensitization. Peripheral sensitization being increased sensitivity to pain in the peripheries, and the central sensitization giving rise to impaired sleep and cognitive disturbances, such as memory issues often referred to as brain fog. More recently, this has been described as nociplastic pain. This is because recent studies show that the area responsible for processing pain in the brain adapts differently and reacts more sensitively to a given stimulus from the nerves in the peripheries. We have certainly found a number of irregularities in fibromyalgia, and it's not the case that this is simply a condition of the mind. One thing we have learned from studying fibromyalgia is it doesn't appear to result from inflammation or damage to the tissues, which makes it different from conditions like rheumatoid arthritis. Fibromyalgia can develop at any age. It seems to be most commonly diagnosed in middle-aged adults between the ages of 30 to mid-50s. It's more commonly diagnosed in women. However, more recent studies are questioning whether men are less likely to be diagnosed with the condition but still may be suffering from fibromyalgia. The exact reasons for this gender difference remain unclear. It does have a variety of risk factors. This could include genetic risk factors, previous trauma. This trauma could be a physical trauma, such as a car accident, or in some cases a psychological trauma. Major infections and prolonged periods of stress or emotional challenges have also been associated, though these may simply worsen the symptoms or coping strategies of those who are suffering from fibromyalgia. It's diagnosed more commonly in the UK and United States, and is picked up less commonly in certain parts of Asia. Though this may represent different practices in diagnosis in these areas. As mentioned, it's thought to be a disorder of the pain processing system in the brain. This results in an exaggerated response of the brain in receiving and processing this pain. Changes can happen in remodeling of the brain, which can then go on to cause changes within the chemical levels within the brain that are responsible for management of pain. Genetic, lifestyle and environmental factors do play a role. As we've heard, sometimes this is precipitated by a major event, which could be a major illness, major trauma or major psychological event, but in other instances, the onset seems to be more insidious, occurring slowly over time, or the accumulation of multiple events. Within the brain, we have seen a number of different things go on. Levels of chemicals involved with pain, like substance P, or brain neurochemicals like noradrenaline and serotonin have all been implicated. Functional MRI has shown different activity levels within the brain for people with fibromyalgia, which further goes to show that there are objective changes in people with fibromyalgia and help dispel the myth that this is simply a condition of the mind. However, there still lacks one specific test that can conclusively diagnose fibromyalgia. This makes diagnosing it quite a challenge due to the lack of specific tests and specific findings on examination. The crucial part of diagnosis is to take a detailed medical history. This focuses on the duration, nature and location of the pain. The pain needs to be widespread and affect multiple areas of the body. Commonly, the pattern of pain is distinct from inflammatory conditions that are much worse first thing in the morning and abate towards the end of the day. Sometimes doctors may check for trigger points, though recent diagnostic criteria don't require these. Because of the breadth of symptoms of fibromyalgia, which presents not only with widespread pain, but also fatigue, disturbed sleep, which is often unrefreshing, brain fog, and in some cases mood disturbances like depression, doctors may order a wide series of blood tests to screen for other conditions that may be contributing. This could include a thyroid function, markers of inflammation, and vitamin levels like vitamin D. Autoimmune screens may also be performed if there are features that might be mimicking other forms of rheumatic disease. Imaging studies can sometimes be helpful, but they're not usually required unless another diagnosis is being suspected. Although it's sometimes said that fibromyalgia is a diagnosis of exclusion, the presence of a characteristic history and normal blood tests can help make a positive diagnosis rather than simply having to rule out other alternatives. At present, we haven't got a cure to end fibromyalgia, but a combination of different treatment strategies can significantly improve the quality of life. The first step is understanding fibromyalgia, and the best thing for this is education. This could be provided in the form of written literature, or maybe delivered in a group session, delivered potentially by a physician or a physiotherapist. Understanding how to manage the symptoms, particularly how to manage the relapsing nature of the condition, what to do on good days to avoid overexertion, and how to manage the bad days in terms of coping strategies for conserving energy are important parts of education. Medications are also helpful. Sometimes simple painkillers can be given, such as paracetamol, or non-steroidal anti-inflammatory drugs like NSAIDs, though their effectiveness is not always great in this condition. Because of the fact brain chemical disturbances have been noted, drugs that are typically used for depression can help to normalize these. Amitriptyline is a tricyclic, which is commonly used and may improve sleep quality, though it can lead to some drowsiness. Duloxetine is a SNRI, selective noradrenaline reuptake inhibitor, and this can help improve brain chemicals that are also involved in so-called downward pathways in pain processing. When there is a lot of neuropathic sounding pain, such as burning, shooting pain, a drug like pregabalin or gabapentin can be used, though this can have some risk of dependence. Managing exercise is a key part of managing fibromyalgia. Pacing activities and ensuring you don't overdo things is crucial to avoid the fatigue that can last for several days following overexertion. Low impact and slowly titrated exercise with things like swimming, walking, and cycling are also helpful. Hydrotherapy, which is physiotherapy conducted in a warm pool, is particularly beneficial, as is Tai Chi. Studies show that regular activity, which is paced, can significantly enhance long-term well-being. In addition, cognitive strategies are often helpful. Cognitive behavioral therapy is sometimes used particularly with a technique called mindfulness therapy. This can help manage some of the emotional and psychological impacts and develop coping strategies to manage the symptoms, including anxiety, stress, and sleep disturbances. In some cases where the condition remains challenging, specialized input from pain management experts can be considered. Though the use of opiate medications is generally not recommended, and evidence shows in the long term is unhelpful. Managing this alongside lifestyle changes, including maintaining a balanced diet, adequate sleep and sleep hygiene techniques, and stress reduction techniques are all supportive parts of fibromyalgia management. Support groups can also provide additional help in understanding strategies that have worked for others. In summary, although fibromyalgia is not an inflammatory disease and is not thought to limit life expectancy, it can still present with a variety of debilitating symptoms. Thankfully, making a positive diagnosis in this condition and getting a wide variety of support early on have been shown effective in helping people with fibromyalgia go on to lead fulfilling lives.